Hello. Am I audible to all? Please let me know. Good morning. Yeah, good morning, Dr. Ankit. Yeah, please let me know. Am I audible to all so that we can start our webinar? Hello. Please let me know. Am I audible? Am I audible to all?
Yes, ma'am, you are audible.
Okay. There are 7 participants now. We will start our webinar. So, shall we go? Give me the message in the chat box. Thank you very much. Okay, so we will start our today's webinar. And today's topic for the webinar is anatomy for the hip joint. Okay, hip joint anatomy. And I'm going to take it in the overview, not in details. Okay, so we will revise everything today. So the first thing is the hip joint. What do you know about the hip joint? Can you tell me in the chat box? So we will cover first the anatomy of the hip joint, and after that I am going to take you applied anatomy. Okay, that is the homework for you. Okay. So now it is audible. Let me know. Am I audible now? Thank you. So basically, the anatomy. First, I'm going to cover the anatomy. So this is the spine. Okay, this is the pelvis, sacrum, spine, sacrum, then the pelvis, inlet and outlet, and this is the femur, and this is the hip joint. Okay, the head of the femur is articulated with the hip bone, acetabular notch. Okay, so I'm going to take in detail. Basically, the thigh bone of the or the femur and the pelvis are joined to form the hip joint. Okay, the hip joint is the largest weight-bearing joint, is the largest weight-bearing joint in the human body, surrounded by the muscle, ligament, and tendons. And it has a high degree. It is a unique joint which is having the high degree of mobility and stability. and anything happen to the hip joint that will be adversely affect the range of motion and the ability to bear the weight, okay, for the any human being. So again, I'm showing you the image of the hip joint. This is the pelvis, this is the pelvis bone, pelvic girdle, then this is the iliac crest, this is the acetabulum, then head of the femur and the acetabulum that form the hip joint, okay. The hip joint. What is the variety? Which variety? The hip joint is the ball and socket variety of the synovial joint. Then the articular surfaces of the hip joint. So as I told you, articulating surface, head of the femur. This is the oval shape head of the femur. Sorry, head of the femur. It articulates with the acetabulum of the hip bone to form the hip joint. And the acetabulum present this horseshoe-shaped unit articulating surface that having the labrum, then the synovial fluid, which smoothly the movement will occur the smoothly every movement, flexion, extension, abduction, adduction, circumduction. Okay, labrum joint capsule. So properly you can see in this image, the hip joint is formed, acetabulum, then the head of the femur. This is the joint capsule. This is the labrum, articulating surfaces for the humeral head also, and the acetabular fossa also. Okay. So do you have any problem in this till now? Anyone? Okay. Again, this hip joint, hip bone, and this femur. Then the blood supply. Then the blood supply. The arteries come from the arteries like obturator artery, two circumflex femoral and gluteal arteries, medial lateral circumflex artery. Okay, this form the blood circulation for the hip joint. So basically, the abdominal aorta is divided into two, right and left, and it forms the network arteries. Okay, circle. This is the abdominal aorta. Then common iliac artery, internal iliac artery. This one. Then the external iliac artery. Then superficial circumflex iliac artery, and the deep. This going to the deep. That's the deep circumflex iliac artery. Then the left circumflex femoral artery, and left circumflex descending. This is the descending branch. Some are the superficial, some are the deep, and this is the obturator artery, which comes from the obturator foramina. Then again, this image is showing you blood vessels, the vein, and the aorta. Okay, inferior mesenteric artery, the same thing. In this image, I am going to see and show the then comes the nerve supply for the joint. So there are three, basically the basic nerves are three: femoral nerve, obturator nerve, and the
Respected one, please mute yourself.
sacral plexus. Repetitive nerve, sacral plexus. So the femoral nerve, then the obturator nerve coming from the obturator foramina, and the femoral nerve goes to the femur, parallel to the femur bone. That's why femoral bone. And the gluteal nerve is on back side to cover the gluteus muscle, maximus medius, and the minimus. Then we are going to see the ligaments of the hip joint. So there are so many ligaments supporting to the hip joint. So we are taking in the short way. Yeah, I'm going to show my I'm going to let you know my introduction after the webinar, because there are very less members when I started the webinar. Okay. The ligaments of the hip joint. The hip joint. Iliofemoral ligament. It is a Y-shaped, inverted Y-shaped ligament, and it is a very strong ligament. That is, and what is the function of the ligament? It prevents the overextension of the trunk.
सितमगर हो तुम तुम्हें जानते हैं तुम्हारी अदाओं में पहचानते हैं.
Inverted Y shape. It is the role is it prevent the overextension of the trunk. And the second one is pubofemoral ligament. It is a triangular in shape and support the hip joint inferomedially. This is the pubofemoral ligament which support the joint inferomedially. Then the ischiofemoral ligament. It is a spiral in shape and attached on the ischia near to the acetabular margin. And it is also the same role. It limits the extension. Ischiofemoral ligament. This one. Posterior. The transverse acetabular ligament is formed by the acetabular labrum as it bridges the acetabular notch, okay, and this provides the surface for the blood vessels nerves to enter into the hip joint. The transverse acetabular ligament. See, acetabular labrum, the acetabular cartilage, and this is the transverse acetabular ligament. Okay. Then the ligamentum teres, and again this ligament has the another name, that is the ligament of the head of the hip. It is a flat and triangular in the form and is attached to the apex of the
Very noisable, not audible.
and its role is adduction and provides the pathway for the blood vessels. Okay, so it limits the adduction of the hip joint and provides the pathway for the blood vessels. Ligamentum teres. This is the ligamentum. Head of the femur. The transverse acetabular which I have told you. So we are going to take the muscles. So what are the muscles for the hip joint? First ones are the extensors. So I'm going to take the hip muscles. Okay. The extensors of the hip are basically the gluteus maximus, then the hamstring. Gluteus maximum. These are the chief muscle of the hip extension. So hamstring and we calling the bicep femoris, semitendinosus and semimembranosus as a hamstring group of muscles. These are the hamstring, the group of muscles, three muscles. Semitendinosus, semimembranosus, bicep femoris, along with the gluteus maximus. This called is the extension of the hip. Then the flexor of the hip, the iliopsoas, that is the psoas major and iliacus. Okay, this one is psoas major and the iliacus. Together forming the iliopsoas, we can call it as the iliopsoas. These are the chief muscle for the flexion of the hip. Then the assistant muscles are the pectineus, rectus femoris, sartorius, and adductor longus. So we can see this is the pectineus muscle, then the rectus femoris, then this is the sartorius, and this is the adductor longus. The role of these muscles are flexion of the hip joint. Then the abductors. So the abductors are gluteus medius and the minimus. So this is the gluteus medius and underneath that the gluteus minimus. Then the tensor fascial lata and then the sartorius, which is I have shown in this image. The sartorius. Then the adductor. Then the group of the adductor muscle. This is the group of the adductor. Adductor brevis, adductor longus, adductor magnus. Okay, and the sister muscles are gracilis and the pectineus. This is the pectineus muscle. This is gracilis muscle. Together, adductor brevis, adductor longus, adductor magnus. Cause the movement hip adduction. Okay. Then the medial rotator. The chief medial rotator muscles are tensor fascial lata and the anterior fiber of the gluteus medius and the minimus. So these are the tensor fascial lata. This one, the tensor fascial lata, and this gluteus medius and minimus. These are the somewhat the deep muscles. Okay. Then the lateral rotator. The lateral rotators are the obturator muscles. These are the obturator muscles, two obturator muscles, obturator internus and obturator externus. This side, obturator externus. Then the two gemelli, inferior gemelli and the superior gemelli, and the quadriceps femoris. And the assisted muscle are the piriformis, sartorius, gluteus, maximus. To cause the lateral rotation of the hip joint. So basically, we have seen the muscles for the hip joint, which causes the movements of flexion, extension, abduction, adduction, medial rotation, lateral rotation, and together all the movement is called the circumduction of the hip joint. So this is the image showing you the hip extension in standing with the knee extension with the knee extended, and this is the hip flexion with the knee flexed. Then the medial and lateral rotators. So this is the lateral rotation of the hip when the person takes the foot outward, okay, and rotate it from the hip joint. And the medial rotation when the toes are inward, that is the medial rotation. When the toes are outward, then the lateral rotation. This is in the standing. And sitting and supine. So this is the internal rotation with the knee flexed. Internal rotation when the great toe is inside and when the great toe is outside. Then the internal rotation. When the great toe is inside, then the external rotation. So there is a difference between when the sitting, the medial lateral rotation in the sitting and standing. So you have to identify this trick. How to identify the medial lateral rotation of the hip in standing and supine or sitting. Okay, now we are seeing the hip abduction and adduction. Taking the foot away from the body is the abduction, hip abduction, and taking the foot, taking the leg inside the body, that is the adduction, hip adduction, and this is the hip abduction. So again, I'm showing you the hip flexion in supine and in standing. Okay. Hip flexion with the knee flexed. Both are the in standing and in supine. And circumduction, it is the combination of the all movement, flexion, extension, abduction, adduction, medial lateral rotation. Okay, together form the circumduction, that is rotation of the hip joint. And the stability of the hip joint, like the shoulder joint, the hip joint belongs to the class of very mobile joint because it has a very long axis, high degree of mobility to perform the various kind of range of motion. So mobility comes at the expense of the stability. However, it comparison with the shoulder joint, the hip joint is much more stable and less mobile. The prime factor in maintaining the stability of the hip joint are ligaments and the joint. So in addition, the shape of the articulating surface. As I told you, the lunate surface, the moon-shaped surface, horseshoe shape. So these are the articulating surfaces also has a great role in the providing the stability to the hip joint, which enhances the stability of the hip joint. Then the applied anatomy. Applied anatomy, this is the homework for you. So you have to find it out from fracture of the femur neck, intratrochanteric fracture, avian of the hip. Avian of the hip is the vascular necrosis of the hip. Then the CTV is the CTV, CDH. These are the found in you. You will find it in pediatric patient. Congenital talipes equinovarus and the congenital dislocation of the hip joint. Then the coxa vera, coxa valga, Perthes disease, and osteoarthritis of the hip joint. So you have to find it out, and so that you will come to know the anatomy and other pathological conditions. So these were the today's webinar. So kindly let me know any doubt you have till now. Now I will introduce myself. I'm Dr. Dr. Trupti Rasal. I'm a physiotherapist practicing in Pune, Maharashtra, and I'm a general secretary for the GAPT. So now I'm taking the webinar for the GAPT. And if you want another webinar on the another topic, please let me know. I will take that also. Okay. So please let me know in the chat box. If you have any doubts, do you have any questions regarding today's webinar, regarding my identity or regarding anything? And your certificates will get after some time. Okay. So please let me know in the chat box if you have any doubts, because the meeting will end now because the time is less. If you have any doubts, please let me know, participants. Dr. Harish Quadri or others. Let me know, do you have any doubt? You can talk to me, no problem. Unmute yourself and let me know, do you have any doubt? Please let me know. Priyanka, please let me know your doubt. Do you have any doubt regarding this webinar? So am I considered you don't have any doubts? Okay. So now we will stop our today's webinar here. Please let me know your feedback. How was the webinar? Let me know how was the webinar so that I can stop my webinar. Have any doubts? One.
It is very noisy, man.
No one is so bye and take care and attend the another webinar when it comes to the next Sunday. Okay. I'm ending this session now. Bye bye.